For too long, Sjögren syndrome has been confined to a narrow understanding. While dry eyes and dry mouth are well known, many people miss the profound ways it can affect your brain and nervous system. I hear a lot of incomplete information about Sjögren's every single day, even from doctors. Patients often experience numbness, tingling, dizziness, or fatigue that is frequently misunderstood or undiagnosed, even though some studies suggest neurological involvement could be as high as 60%. This video will delve into these often overlooked neurological signs that everyone needs to be aware of. Before we continue, I built something specifically not for just tracking and doctor's appointment. It is called Sjögren's Ultimate Symptom Map and Diagnostic Action Plan, and it walks you through exactly which symptoms to track not just for Sjögren but also for MS and RI. Drop symptom map in the comment, and I would send the link for you to access it. Neurological Sjögren's is real. And for many, it's the first sign something's wrong. Not the dry eyes. Not the dry mouth. But the weird, creeping numbness. The dizziness that comes out of nowhere. The brain that feels like it's constantly wrapped in fog. Here's where things get frustrating. Studies suggest that neurological involvement may occur in over 60% of people with Sjögren's. 60%. That's the majority. And yet, it's rarely tested for. Even more rarely explained. And almost never taken seriously in early stages. Think about that for a second. You walk into the clinic feeling completely off. You're not yourself. Maybe your thoughts are slower, your balance is off, your skin burns or tingles. You explain it as best you can. But the moment your doctor sees normal labs, the conversation ends. They rule out everything serious, and they move on. But Sjögren's doesn't play by lab rules. It doesn't always shout through your inflammation markers like CRP or ESR. Instead, it creeps through the nerves, weaving into your peripheral system, your autonomic regulation, and in some cases, your brain itself. Quiet, persistent, and completely missed unless someone knows exactly what to look for. That's why this video exists. Because if this is happening to you, or someone you love, you need clarity, not gaslighting. Answers, not assumptions. And most of all, a path forward before the damage becomes permanent. Now let's break it down symptom by symptom, starting with the one that catches nearly every patient off guard. Peripheral neuropathy. Let's talk about peripheral neuropathy, the most common, and most ignored, neurological symptom in Sjögren syndrome. What exactly is it? Peripheral neuropathy happens when the nerves outside your brain and spinal cord, specifically the ones in your arms, legs, hands, and feet, begin to malfunction. These nerves are responsible for sensation, movement, and balance. When they start to break down, your body sends signals that don't make sense. Or worse, it stops sending signals at all. But here's the twist. In Sjögren's, the attack isn't always dramatic. It doesn't start with you collapsing or losing the ability to walk overnight. It starts with something subtle. Something weird. You pull on your sock, and your foot still feels like it's bunched up inside it. You step into a warm shower, and suddenly the water feels acidic, almost like it's burning your skin. You try to sleep, but your bedsheets feel like sandpaper, and your feet buzz with static electricity. Or maybe the top of your thigh goes numb after a short walk. Maybe your hand tingles just from holding your phone. Maybe your feet feel like they're constantly asleep, even though you're up and moving all day. These aren't just odd sensations. These are your sensory nerves being attacked. And in autoimmune diseases like Sjögren's, this damage isn't random. It's targeted. It's your immune system mistaking your nerves for a threat, and slowly eating away at them. And yet, how many people are told it's just aging? Or just poor circulation? Or worse, just in your head? I'll tell you how many, thousands. Especially women over 40. Especially those with vague symptoms. Especially those who don't look sick. If this is ringing any bells, don't ignore it. Don't chalk it up to stress or fatigue or being dramatic. Peripheral neuropathy is one of the most important early signs that your nervous system is under siege. And it doesn't stop there. Coming up in next, we'll break down the two major types of peripheral neuropathy, small fiber and large fiber, and explain why your tests might still come back normal even when your nerves are already failing. Now, not all peripheral neuropathy is the same. In fact, understanding the type of nerve damage you have is one of the most important steps to getting the right diagnosis and the right treatment. So let's break it down. There are two major types of peripheral neuropathy you need to know about: small fiber neuropathy and large fiber neuropathy. Let's start with small fiber neuropathy, often abbreviated as SFN. This affects the thin, delicate nerves responsible for carrying pain and temperature signals from your skin to your brain. These are the nerves that tell you when something is hot, cold, sharp, or irritating. But when these small fibers are damaged, those signals get distorted. Or they get stuck in a loop. Suddenly, your skin might feel like it's on fire for no reason. A cool breeze on your leg might feel like sandpaper. A light touch from your shirt? It might feel like needles. Some people feel burning, others feel stinging, others describe it as electric shocks running up and down their arms and legs. And here's the kicker: this pain doesn't show up on routine blood work, MRIs, or even standard nerve conduction studies, EMGs. So when you go to the doctor and say my legs burn all night, or my feet feel like they're on fire, and your tests come back clean, they say, well, everything looks fine. No. It's not fine. Small fiber neuropathy is real, and it's common in Sjögren's. But you need the right tests to find it. The gold standard? A skin punch biopsy, a small sample taken from your leg or thigh to measure the density of nerve fibers. If those fibers are dying or gone, you've got your answer. Now, let's talk about large fiber neuropathy. This affects the bigger nerves, the ones responsible for reflexes, vibration sense, muscle strength, and your awareness of body position, also called proprioception. When large fibers are damaged, your symptoms change. Instead of burning, you might feel numb. Like your feet are wrapped in foam. Or like you're walking on a mattress. You start tripping over your own toes. Or you can't feel the floor beneath you in the shower. Balance becomes a serious problem. Especially in the dark. This is the type of damage that leads to falls. And when you're over 60, one bad fall can change your life forever. But just like small fiber neuropathy, large fiber damage can also hide from standard EMGs, especially if it's intermittent or early. That's why it's crucial to connect the dots before something catastrophic happens. Coming next, we'll walk through real-life stories, including one from Judith, who suffered for years before finally being diagnosed, and explain exactly what tests to request, what symptoms to report, and what to do if your doctor dismisses your concerns. Let me tell you about Judith. She was 57 when the symptoms started. Nothing dramatic at first, just a strange tingling in her toes. Then a burning sensation in her calves. She assumed it was bad shoes. Maybe poor circulation. Maybe she'd pulled a muscle. Over time, it got worse. Her feet burned so badly at night she had to sleep with them outside the blankets. She couldn't wear socks anymore, they felt like sandpaper. She tried switching lotions, elevating her legs, even ice baths. Nothing worked. Then the tingling spread to her hands. Buttons became difficult. Typing became painful. And the worst part? Every time she saw a doctor, the same thing happened. Blood work looks fine. Your EMG was normal. Maybe it's anxiety. Try stretching. Get more rest. It took 3 years before a rheumatologist finally suspected small fiber neuropathy and ordered a skin punch biopsy. The results? Devastating. She had lost more than 50% of her small nerve fibers. Permanent damage. Directly caused by Sjögren's. Judith told me something I'll never forget. I wasn't crazy. I wasn't sensitive. I was right. My body was screaming, and no one listened. How many people are walking around like Judith, burning, tingling, numb, and being told it's all in their head? Let's make this practical. If you're dealing with unexplained sensations, burning, numbness, electric shocks, pins and needles, and your EMG or MRI came back normal, here's what you need to do. Say this to your doctor. I'm experiencing persistent burning and tingling that doesn't match my lab results. I'd like to be evaluated for small fiber neuropathy. Can we order a skin punch biopsy, or refer to a neurologist familiar with SFN? This one sentence could cut years off your diagnostic journey. And here's another important point. Knowing which nerves are involved changes how you manage your condition. If it's small fibers, the focus is often on neuropathic pain management. Things like gabapentin, duloxetine, or immunosuppressants if inflammation is active. If it's large fibers, you might need physical therapy, fall prevention strategies, and even mobility aids to stay safe and independent. But if it's both? That's when you need a full team. neurologist, rheumatologist, and sometimes even a pain management specialist. Up next, we shift from sensory symptoms to something even more physically disabling, motor neuropathy, where Sjögren starts attacking the nerves that control your muscle movement. Now we enter territory that feels more visible, more physically frustrating, and often more emotionally devastating, motor neuropathy. This is when Sjögren stops attacking your sensory nerves and starts going after your motor nerves, the ones responsible for muscle control and coordination. And when that happens, the body doesn't just feel odd or painful, it begins to fail in ways that are impossible to ignore. Let's break it down. Imagine trying to open a jar, and your hand suddenly trembles. You can see the lid. You want to grip it. You try to grip it. But your fingers feel like they don't belong to you. Or maybe you're eating dinner, and halfway through the meal your hand starts shaking. Your fork slips. You pretend to laugh it off. But inside, you're terrified. You know that's not normal. Maybe it starts even smaller. Your handwriting changes. Your hand cramps when you write just a few lines. You can't hold a hairbrush without your wrist getting sore. Your legs shake after standing for 5 minutes. You're tripping over shoes you used to step over with ease. These aren't isolated moments. This is your motor control breaking down. Slowly, quietly, and without intervention, permanently. And here's what makes motor neuropathy even more dangerous than sensory. With sensory neuropathy, your world feels distorted. With motor neuropathy, your body stops obeying. You lose grip strength. You fumble with your phone. You start dropping mugs, dropping pens, dropping your toothbrush. You start falling. And when you fall, especially after 60, it can cost you your independence, your mobility, and in many cases, your life. So how do you recognize motor neuropathy early? Here are red flags. Your grip strength is noticeably weaker, even though you haven't injured your hand. You feel clumsy, as if your hand forgets how to hold objects. Your shoes feel looser, not because they are, but because the muscles in your feet are shrinking. You have trouble brushing your teeth or holding a phone for more than a few minutes. You find bruises on your shins, but you don't remember bumping into anything. That's because you're stumbling, and your brain isn't tracking it. This is not aging. It's nerve dysfunction. Your brain is sending the signal. But the motor nerve is damaged, and the message doesn't get through. And the longer this goes unaddressed, the more muscle you lose. We'll go deeper. What early muscle wasting looks like, the one visual test you can do right now with your hands, and how to demand the right care, even if your EMG comes back normal. So how do you know if your motor nerves are starting to fail, before it's too late? Here's one thing I tell every patient. Look at your hand. Specifically, the fleshy pad between your thumb and your index finger. That space is called the first dorsal interosseous muscle. Normally, it's full and firm. But if it looks hollow, like the muscle is caving in, or there's a sunken dip, that can be a visible sign of muscle wasting. That's not just aging. That's not weight loss. That's your motor nerve dying, and your muscle atrophying because the signal to keep it alive isn't getting through. You can also check your calves. Have they lost their shape? Do they feel softer, flatter, less defined, even though you're still walking every day? That's another early sign. But here's the kicker. Even severe motor neuropathy can be missed by routine tests. Standard EMGs, electromyograms, are helpful, but they are often limited. They test for electrical response in large nerves, but they don't always pick up early, intermittent weakness. They can completely miss functional breakdown. That's why if you're failing to hold a toothbrush, if you're tripping more often, if your legs feel like jelly after 10 minutes, don't let a normal EMG be the end of the conversation. Say this to your doctor. I know my EMG came back clean, but I'm still experiencing real weakness and muscle fatigue. I want a referral to a neuromuscular specialist for a functional motor evaluation. Don't ask. Tell. Because here's the truth. When it comes to motor nerve damage, time is everything. The sooner you identify it, the better chance you have at slowing it down, or even partially reversing it. Let me tell you about John, a 68-year-old grandfather from Tallahassee. It started with a limp. Just a small one. He barely noticed it. Then, his handwriting changed. His signature became tiny, shaky. His wife said, "Why are you gripping the pen so tight?" 3 months later, John couldn't pick up his grandson. "I used to toss him in the air," he told me. "Now I'm afraid to lift a spoon." That's not just weakness. That's loss of identity. That's what this disease can steal from you when motor neuropathy goes unchecked. And it's preventable, if caught early. Now we enter one of the most silent, misunderstood, and dangerous battlegrounds in Sjögren's, the autonomic nervous system. Think of this system as your body's autopilot. It runs everything behind the scenes: your heartbeat, your digestion, your bladder, your body temperature, even how you sweat. You don't think about it. You're not supposed to. It just works. Until it doesn't. When Sjögren's attacks the autonomic nervous system, that invisible control panel starts to short-circuit. And the fallout can feel completely random unless you know what to look for. Let's start with one of the most alarming signs: POTS, postural orthostatic tachycardia syndrome. Here's what that looks like. You stand up, and suddenly your heart rate spikes. You feel dizzy. Maybe lightheaded. Maybe like you're going to faint. You try to push through, but your vision goes blurry. You have to sit back down. Sometimes your hands are shaking. Sometimes your chest pounds like you just ran up 5 flights of stairs, even though all you did was get off the couch. That's not anxiety. That's your autonomic nervous system failing to regulate blood pressure and heart rate. And it's one of the hallmark signs of dysautonomia, an umbrella term for this kind of dysfunction. But it doesn't stop there. Autonomic neuropathy can also wreck your ability to regulate temperature. Some people with Sjögren's feel like they're boiling in mild heat. Others get chills when everyone else is sweating. You might stop sweating entirely, or you might sweat in weird patches. Your face sweats while your arms stay dry. Then there's the digestive fallout. Your gut has its own mini-brain, and it's controlled heavily by autonomic nerves. When those nerves are damaged, you can develop something called gastroparesis, where your stomach doesn't empty properly. Food sits in your gut too long, making you bloated, nauseous, or full after just a few bites. You might swing from diarrhea to constipation, sometimes in the same week. You feel full, heavy, and miserable after normal meals. And no matter how many digestive enzymes or probiotics you try, nothing feels right. Next, the bladder. When autonomic nerves are involved, urinary symptoms can get weird. You might struggle to fully empty your bladder. Or feel like you always need to go, but barely release anything. In men, this is often misdiagnosed as prostate trouble. In women, it's dismissed as overactive bladder. But often, it's autonomic dysfunction. And let's not ignore the most taboo symptom: sexual dysfunction. Loss of libido. Genital numbness. Difficulty achieving climax. Painful sex that has nothing to do with dryness. These are rarely talked about, but they are common when Sjögren starts attacking the pelvic nerves. And they can wreck relationships, self-esteem, and mental health if they go unexplained. Let me be crystal clear: you are not crazy. These symptoms are not imagined. They are the neurological fingerprints of autoimmune inflammation in your autonomic system. Now we are stepping into the most critical, and frankly, the most terrifying, territory. This is what happens when Sjögren stops playing at the edges of your nerves, and starts attacking your central nervous system, your brain and spinal cord. Let's get one thing straight: when Sjögren's reaches this level, this is not about discomfort anymore. This is not about dry mouth or fatigue. This is where it becomes a neurological emergency. And most people, including many doctors, don't know what it looks like until it's too late. So let's talk about it clearly. You could be walking around, feeling dizzy for weeks. You notice headaches that don't feel normal. Not the kind you've had for years, but deep, throbbing headaches that press behind your eyes or grip your skull like a vice. You go to the ER. Maybe they run a CT. Maybe they say it's a migraine. But it's not. It's brain inflammation. It's encephalitis caused by autoimmune attack. You might start forgetting words mid-sentence. You space out during conversations. You feel confused in familiar places. Then one day, your legs won't work. You can't lift your arm. You collapse. By the time you're in the hospital, the doctors are finally calling neurology. You're getting an MRI, a lumbar puncture, maybe 4 steroids. But it should have never gotten this far. Let's go through what to watch for, right now, so you can act before the damage is done. 1. Persistent, strange headaches. Not migraines. Not tension headaches. We are talking about pressure behind the eyes. Pain that doesn't respond to medication. Headaches that build for days and make you retreat into a dark room. 2. Brain fog that's not just forgetfulness. This is confusion. Losing track of where you are. Forgetting common words. Struggling to read, write, or follow conversations. Feeling mentally locked out of your own life. 3. Dizziness and vertigo that disrupt your balance. This isn't from dehydration. It's the kind where you feel like the room is spinning or like you're on a boat, even when you're sitting still. It's terrifying. And it's dangerous, especially for older adults at risk of falling. 4. Vision changes. Blurry vision that comes and goes. Seeing double. Loss of peripheral vision. Extreme light sensitivity. Not caused by dryness, caused by inflammation in the optic nerves or visual cortex. 5. Fatigue that is different. We all know fatigue in Sjögren's. But this is something else. This is neurofatigue. Your limbs feel like they're made of stone. You sleep for 10 hours and wake up feeling wrecked. You can't lift your arms. You feel short-circuited, like your entire body is unplugged from its power source. 6. Stiff neck plus balance issues. This combination is a red flag. A rigid neck with no clear cause, paired with new coordination problems or unexplained stumbling, that could signal meningitis, inflammation of the protective lining of your brain and spine. And yes, Sjögren's can cause this too. Now let's talk diagnoses. These are the ones that can change your life in a matter of days. Autoimmune encephalitis, inflammation of the brain. Can cause seizures, memory loss, confusion, and even coma. Requires emergency steroids and immune therapy. Autoimmune meningitis, not bacterial. But still dangerous. Causes fever, stiff neck, photophobia, and mental fog. Transverse myelitis, inflammation of the spinal cord. Can lead to paralysis, bladder and bowel loss, and intense pain. One of the most severe Sjögren's complications. Mononeuritis multiplex, this is nerve death in clusters. You might lose the ability to lift your wrist drop, or foot drop, almost overnight. It's alarming. And it requires immediate treatment with immunosuppressive drugs. Increased stroke risk, yes, Sjögren's increases your stroke risk. That's not fear-mongering, it's medically documented. Let me be blunt, this is life-altering if missed. So here's your action plan. If you are experiencing multiple neurological symptoms, especially if they are progressing, you need to say the following to your doctor or specialist. Doctor, I'm experiencing neurological symptoms that are impacting my quality of life. I've been diagnosed with, or strongly suspect, Sjögren's syndrome. I need a full neurological evaluation, including MRI of the brain and spine, and possibly a lumbar puncture. I'm concerned this may be autoimmune encephalitis or another CNS complication. You may need to repeat that. You may need to push. You may need to get a second opinion. But it could save your life. I don't say any of this to scare you. I say it because you deserve the truth. Sjögren's is not just dry mouth and dry eyes. It is a full-body autoimmune disorder that can quietly dismantle your nervous system if it's not recognized and treated early. You are not imagining your symptoms. You are not alone. And you are not helpless. There are tests. There are treatments. There are options. But it starts with recognition. It starts with knowing what to look for, and demanding to be heard when something doesn't feel right. If this video opened your eyes, I want you to do 3 things right now. 1. Hit the like button. It helps this video reach more people who are suffering silently. 2. Type nervous system in the comments if you've ever felt dismissed, misdiagnosed, or misunderstood. I read every comment, and your story matters. 3. Share this video with someone. A family member. A friend. A Facebook group. You never know who you might save from years of misdiagnosis. And of course, subscribe to the channel for more deep, honest, medically backed breakdowns of what's really happening in autoimmune disease. Thank you for watching. I'm glad you're here. You deserve clarity. You deserve support. And you deserve a medical team that takes your symptoms seriously. I'll see you in the next one.